This conference will now be recorded.
Hello all, I am Ali and we are going to talk today about some of the important tasks that may come in the November exam. First of all, I hope all the best for the people who are going to November, and we will not talk today about the module of the exam. How is the module, what is the module, how you can tackle this module in the exam. I think all of you have gone through this already, and you are now on the time of practice. I think you have only less than 1 month, so this month I think it will be enough for you to practice and to repeat the task again and again. Don't waste your time to read more and more tasks, new tasks, and I think it will be better if you revise the tasks that you already discussed, revise the recall, because they keep coming, keep bringing the recall, repeat the tasks again and again. So most of the exam will come from the recall, about 10 to 11 cases. And if they bring 2 or 3 cases new, I think if you put a template for yourself, you can tackle this and you can answer this quickly and easy. I want to give you some small advice for all of you. If you are in the exam and you face a new task or a new topic that you didn't cover it before, don't be anxious and don't worry. You can take mark for this task. How can I take mark in this task? By information gathering, organized and systematic organization of the history of information gathering, and be safe, doctor. If you tackle the safety point in this task, and you do a good communication with the patient in this task, you can pass in 3 domains, and there will be only one left domain, which is applied knowledge. It can be uh, covered in another module. It can be reached by the other modules. So don't worry if you find in the exam a new task or a new scenario you didn't practice it before. Don't worry, it will be the similar, okay? Because no one can cover each topic in the world, each disease in the world. See, sometimes they bring a new disease for you, like Albert syndrome, like Charcot-Marie tooth, like talibus, like echogenic bowel, any new things for you, renal transplant, any new things. No one can cover all the disease, so it will be the same. If you put template for yourself, it will be the same. Take information, take in history in a systematic way as you used to do, okay, and talk with the patient about the effect of the disease on the pregnancy and the effect of the pregnancy on the disease if it in the antenatal and the maternal medicine module. Okay, then go to the suggested plan. I wanted to tell you that you still can pass in this task, or at least pass in 3 domains in this task, if you don't know anything about it. Okay, and this happened and it will continue to happen. Okay, so don't worry about that. My advice for you now is to keep practice, repeat and again, repeat again and again the recall, repeat again and again, again and again, and please try to read also the green top guideline and the nice guideline related to the task, okay? Because the applied knowledge will give you confidence in yourself, okay? And also sometimes some point in the patient safety should come from reading this guideline. So if you put for yourself a very short time, 10 to 15 minutes for the meeting the guideline related to the task, okay, and this will be much more enough. No time now for reading the patient information leaflet. You can see some of the videos, like strategy videos, like Lisa Joel videos, if you have these videos, okay, to know how they do, or to see how the candidate can tackle the scenario in the exam. Okay. I want to go direct to the scenarios today, the tasks today, not to waste your time. I wanted to today to take as much of the tasks as we can. Okay, please, we can differ or postpone any question, any discussion after we finish the session today, not to waste the time of the other people who want to practice. Okay, so if you have any question, we can discuss this in the group or after the finish of the session. Okay, so let's go to the first one. I will try to give. I cannot say most of you or all of you today because the time will not allow you. But if I try to take to the one who sent for me first, and the other one, I will try to do another session. Okay, and to give the opportunity or the chance for all the people or most of the people to practice. Some person sent for me the name, but I cannot. Uh, uh, I don't know what is the name. It is not written here. Like Dr. Nairuz. Dr. Nairuz sent for me on the chat. Nairuz. Okay. Dr. Manikam.
Good morning, sir. I'm ready, sir.
Okay. If I say the name right, correct?
Correct, sir.
Okay. Good. Okay.
They
Manikam. Okay.
yes, sir. They call me as Money.
Many. Okay.
Yes, sir.
Okay. This is your task. I will adjust 2 minutes for you.
Okay, sir. Sir, shall I start, sir?
Okay. Good. I will adjust 10 minutes.
Hello, I am Dr. Monicam, doctor in the EPAU clinic. May I confirm your name and age, please?
Sarah Smith, 32 years.
How you want to be called?
Sarah is fine.
Sarah, you have 48 hours before, I came to know that you have come with mild vaginal bleeding, and you had your last periods 6 weeks ago, and you had pain also. Now, how is your pain?
My pain now is fine, doctor.
Hmm. I came to know that your hormone level was 2900 then. Um, any other concern you want to discuss today?
No, doctor, I came since 2 days here, and your colleague examined me and offered me some tests and
Hmm.
a scan, and asked me to come today to repeat the test again. So
Uh,
I wanted to know the result of this test and what will be my plan of treatment.
before discussing about your scan report and blood test reports and your management options, shall I ask a few questions to know more about you? Then
Yeah,
I'll give you the. Then we'll discuss and come to a shared decision. How does it sound?
okay,
Uh,
that's fine.
please, Sarah, tell me about your condition. How does it started?
Yes, I started since 3 days when I have some pain in my right side,
Mm,
and this pain is going to my leg as well.
mm,
Uh, and also I have some spotting. It is not too much bleeding, it's just a spotting.
mm. Was it spreading anywhere? The pain?
Only to my right leg.
Has it subsided with the painkillers, or now do you have any pain?
It is still come and go.
Uh, okay, it is coming and going. And
Mm,
is there any burning while crossing V?
no,
Do you have any loose stools?
no,
Any fainting attack in the house? Did you have a felt any dizziness?
no, doctor.
Any shoulder tip pain?
No.
Uh, tell me about your periods. Were they regular? Please tell me.
Yes. My period is regular and last one since 6 weeks.
Mm. Is this a planned pregnancy or unplanned?
No, it is unplanned pregnancy.
Mm. Uh, did you use any contraception before, like intrauterine device like that? Any coil before? Not now.
Only we use condom, but at that time the condom break and the pregnancy happened. I have missed the period, but it is welcomed.
Oh. And one more thing I want to ask is, you may find it intrusive. Shall I ask you?
Okay?
Have you been ever treated for any sexually shared infections?
No,
Any treatment for pelvic infection?
no,
Uh, have you been pregnant before? You had one child, I think. Was it? What is the age of your child?
a 3 year.
Uh, um, how is he? He or she? I do not know. Is she fine?
Tom is fine, yeah.
Mm. Uh, do you have any medical condition for which you are treated by a GP?
No,
Do you have any allergies?
no,
Are you on any medications?
no.
Any surgery in the past?
Yes, I have a surgery for appendix.
Oh. How did you recover?
It was fine.
It was by open surgery or keyhole surgery?
It was by keyhole.
Uh, uh, do you have any family history of any specific condition like clot formation?
No,
Hmm. Do you smoke?
no,
Do you take alcohol?
no,
Pardon me, any recreational drugs?
no.
Are you aware of your weight to height ratio?
Yes, it is 28.
Hmm. Uh, do you know your blood group?
And it is O positive.
O positive. Any reservation against transfusion?
No?
How are you supported in the family?
Yes, my partner is very supportive. He loves
Hmm.
me so much.
Hmm. Do you feel down depressed for the past 4 weeks?
No, at all.
Hmm. Uh, um, Sarah, I want to thank you for the information you have provided. Do you want to add anything?
No, at all.
Uh, I want to examine you in presence of chaperone with your consent, and the blood pressure, heart rate, temperature will be recorded by the specialist nurse. Sarah, mm, I have verified your name, NHS number, and age with your reports.
Okay.
The pregnancy hormone level has shows a rise, but it is not up to the mark. And are you alone?
Why, doctor?
Um, I have a concerning news for you. I do not have a good news. Sorry. Uh,
What
shall I
happened?
ask shall I ask the specialist nurse to be with you for support?
No, no, doctor, I can manage. Can you tell me direct what happened?
Mm. I'm really very sorry to be the bearer of the news,
No, no, no. What?
Sarah.
Mm.
This first scan showed not, it was inconclusive, but the second scan shows in the right side there is in the tube there is a small mass measuring 2.7 centimeter. At the womb is empty, and the pregnancy is there. Therefore, it is occurring in the right tube. It is called we call it ectopic pregnancy. The
Oh,
pregnancy occurring in the tube.
oh my God.
I'm
Oh my
sorry
God.
to be the bearer of this news.
Oh my God. Oh, oh my God, my baby. Mm. Oh my God. So, doctor, any method to put my baby in my womb?
I'm able to see that you're in a distress condition. I'm sorry. It is a abnormal position. It cannot grow there. This tube is very small structure.
Why,
Due to
doctor?
some,
Why?
mm, you had one surgery before. No, that should have gone for some organs stucking to each other. That has prevented the movement of the tube. Usually, the baby is formed in the tube. I'm showing you with the diagram. So, the baby is formed in the tube and it gradually comes down and to reach the womb. As the movement is disturbed because of this organs getting stuck to each other, it has stayed there itself, I think. As you do not have any sexually shared infection or smoking, these factors are not there. So this should be the reason.
Okay, so what happened next, doctor?
Uh, but it is not show. It's not showing any heartbeat. That is a good thing. Your care will be. We are here to help you. Do not worry, Sarah. Your care will be under the care of the consultant unit under care of the group of specialists, including my consultant, specialist nurse, the imaging doctor, the hormone doctor, the physician, the pain doctor, and the mm,
Okay.
psychological counselors and support groups are also there. So, after running some tests, that is to find whether your liver is working well and kidney is working well, and whether you are anemic to find a full blood count. And after this, if you can come for follow up, uh, there are three methods of treatment usually. One is the medical treatment and other surgical treatment. Other one is the conservative management. It is not possible in your condition as the levels of hormones are high. So, if you are wishing, you'll be offered the medical management. The other one is the surgery method. If you can come for follow up, medical management can be followed. Shall I explain that to you?
Yes, please. I wanted the medical
Mm.
one. I don't
Uh,
have I don't want
mm.
to have surgery.
Uh, According to your weight, the injection methotrexate will be given in the muscle. Uh, as you have received this, done this test now, after running this liver test and kidney test and a full blood count, this injection will be given and you will be asked to come for on the day 4 and day 7 for again the measurement of the pregnancy hormone. And if it falls more than 15%, you will be allowed to continue the treatment weekly once this measurement will be done. This will go for shrinkage of the pregnancy tissue. And there may be some side effects. You should not take any alcohol and you should not go in sunlight and should avoid intercourse or heavy exercises. Am I clear so
That's
far? Mm.
but
Some
you
may
make
develop some nausea, vomiting,
okay.
uh, and this will come to normal.
Mm.
Then, uh, if it does not fall more than 15%, then the scan will be taken to find any heartbeat of the baby, and the consultant will review you. And if there is no heartbeat, she'll be offering you one more injection, and again it will be followed with a weekly test. Am I clear?
Yes, you are clear, doctor.
Otherwise, if the baby's heartbeat is present, there's no other go. We have to opt for a surgical management, and only 7% require surgical management, 7 in 100, whereas 15 and 100 may require injection, second injection. And women who receive this injection are advised to follow some contraception method, safe, reliable contraception method for 3 months, so that this medicine goes out of the body and the other pregnancy will be safer. Am I clear? And there is a
Yes,
chance. And one
yes,
more thing I want to tell you, you're not able to, you're not asking any question. Am I clear so far?
yes, doctor, you are clear.
Mm. Mm. I want to tell you, there is a chance of recurrence in the next baby also. So when you get pregnant next time, mm, as you had one history of surgery, appendectomy, and now you had an ectopic pregnancy, so you should come early in the once you miss your periods to come for a urine pregnancy test. And if it becomes positive, you should be advised to have a scan at about 6 weeks, so that we can find out at early stage if it occurs. The chance is a little more. No, usually it occurs in uh, 5 to 7 in 100 women. So if it happens like that, it can be detected early and it can be treated with medication. So that only you are advised to come earlier. And if you are when you are given this medicine and you are going home, to develop any increased pain in the tummy or any dizziness, should be having good support in the home, so that somebody should be there to bring you immediately to the hospital for medical help. Am I clear so far?
Yes, you are clear, doctor.
Do you have any doubts, Sarah?
No,
Um, mm, do not worry, we are here to support you. We'll do all the needful for you. I'll give you the patient information leaflet. I'll document everything, and I am writing back to your GP. And now you are being offered this test. The specialist nurse will take the blood samples for your test, and after reviewing this, my consultant will examine you, and she will give you this injection. Do you have any other question, Sarah?
no, no, thank you.
Uh, uh, Thank you, Sarah, for your time.
Thank you. Thank you, Dr. Manny. Well done. Excellent, Dr. Manny. You did the task in an excellent way.
Thank you, sir.
You take every point in the task, to be honest.
Sir,
Uh,
in Tamil, they used to say a ringed finger. You only started, sir. I first presented the case only to you, sir. That is the first hit with the finger wearing a golden ring. Like that, I got hit from you.
okay,
So I am getting reward from you. Thank you, sir. Thank you so much, sir.
thank you,
Please
thank
bless me, sir. Bless me, sir. Thank you.
you, thank you very much. Well done, excellent. You did the task in an excellent way, but the problem is the time management. So, as we
Mm,
know,
mm.
any point you will mention after the time, you will not take any point about this. You will not take any credit
Okay,
about
sir.
after finishing the time. They will
Mm,
even they will not allow you, even if
okay.
the and the face and face
Mm,
exam
mm.
or in the Osler, they will not allow you to talk after that. Okay, and it
Mm,
will be also something not good to
mm,
stay in the cubic if you are in the face and face is still
mm.
talking after the time. Okay, so the problem, as you know, the time management. So try
Yeah.
please to finish within the 10 minutes, and you will
Mm.
come by practice again and again.
Okay, sir.
Okay, to try to finish that in the 10 minutes, but otherwise
Mm,
you managed the task in very nice way. Your communication with the patient usually start by communication, because communication in part 3 is the most important domain in
mm,
part 3 exam.
mm.
Okay, so communication is perfect, your lay language is very good, your sympathy is perfect, you give information in small chunks, you check understanding. I think you draw. Did you draw?
Yes, sir.
Okay, good.
I told you as if I'm drawing.
Yes,
Sir, I'm going for face-to-face exam, sir.
yes, good, good. So, okay, this is the best example to draw. Ectopic pregnancy, the best example you draw. If you didn't draw in the ectopic pregnancy, you will not draw for any other task. So drawing is very important, okay?
Yes,
Especially the face and face exam. So your communication with the patient is perfect. Regard to the patient safety, the second important domain of patient safety is perfect. You take all the point for the patient safety regarding to the contraception. If she received the methotrexate, the warning sign, even you warn her about the warning sign when she go home, when she should come to the hospital immediately, and even in the next pregnancy, you warn her about the next of the possibility of the recurrence in the future pregnancy, the blood group, everything you in the patient safety to witness. Information gathering was organized, systematic, okay, and you the best thing is that you ask about the history of present illness, which is the symptoms and sign of ectopic pregnancy in details to check for the patient safety, if the fainting, attack, deep pain in shoulder, amount of the bleeding, everything. So information gathering also was organized, systematic, and you cover all the points. You cover the surgical, which can be a predisposing factor, the sexual history, which may be a predisposing factor, the smoking, which may be a predisposing factor, everything. Only you can stress please on the contraception because this is unplanned pregnancy, so please stress on the contraception. If she doesn't want to have unplanned pregnancy or after this event, she should use a reliable method of contraception. Okay, so
yes, sir. Sir, one thing I have forgotten, sir. We should avoid intrauterine contraceptive device, no, sir. That I should have told.
Intrauterine device increase the risk of ectopic pregnancy, increase the
Yes,
risk
sir.
of ectopic pregnancy. Okay, so you should stress on the stress on the reliable method of contraception. So this is I want from you to stress on this point.
Okay.
Applied knowledge about the ectopic pregnancy. Your applied knowledge is perfect. Okay, so you know that there are three in general. There are three methods of managing the ectopic pregnancy, which is a conservative measures. Wait and see, give the nature time to take its action. Okay, it is the conservative method. The second method is the medical management, which can be by the methotrexate, and the last option, the surgical method. You know from your the NICE guideline, the wait and see or the conservative cannot be offered here because the beta HCG is high, so this cannot be offered for this patient. So she still have two options, which is the medical option and the surgical option. The patient prompt you, she doesn't want to have surgical. What I suggest for all of you, if you have a list of options for the patient, any patient, there are a lot of options can be offered for the patient, and no one can cover all the options at all. For example, in this one, in the patient with menopause, in the patient with PMS, in the patient with station incontinence, urge incontinence, there are a lot of options can be offered for this patient. So how can we do that? I suggested to mention the broad line of the option in the start and ask the patient which one you wanted to start, which one you wanted to know more. Okay, she may prompt you to mention about the medical, she may prompt you to talk about the surgical. Okay, so you are now save your time because no one can cover all the options listed for the treatment of a huge thing like that. Okay, so this patient prompt you to talk about the surgical because the time cannot allow you to talk about everything in the medical and surgical. You talk about the medical in the nice way. So the medical can be methotrexate. Some side effects of this methotrexate like sore eyes or mouth, chest and abdominal discomfort. She will stay in the hospital over the night, and they may come again on day 4 and day 7 to repeat the beta HCG. If a drop of the beta HCG by 15%, she will continue weekly till back to come back to the normal. But if it not drop by this percentage or by this way, so she may need another dose of the methotrexate. Very important thing that if she feel any pain, any bleeding, feeling unwell during this period, she should come back to the hospital immediately. Okay, and she should use a reliable method of contraception for at least 3 months. If the patient choose the surgical, you know how to counsel her about the surgical. Sure. Okay, so it will be done by a keyhole surgery, and there are two methods of the surgical: either to remove the tube by the pregnancy, it's called salpingectomy, or to remove only the pregnancy if during the time of the surgery we found that the other tube is deceased. So it is called salpingotomy. If the patient offers salpingectomy, will offer a urine pregnancy test after 3 weeks. If it offers salpingotomy, you will do the beta HCG or the urine pregnancy test in a weekly basis till it drop back to the normal. Dr. Manny, very good, excellent. She talked about the future pregnancy and she warned about the risk of the recurrence in the future pregnancy. She may need an early scan to check that the pregnancy inside the womb in that time. And at the end, you have to give the patient some patient information leaflet to read about the topics and give her contact number she should contact if she has any query or she have any emergency. Thank you, Dr. Manny.
Thank you, ma'am. Thank you, sir.
Thank you.